Okay. Thank you to everyone joining us today for our community conversation about the COVID-19 virus here in Pitkin County. On behalf of the Board of Pitkin County Commissioners, I want to extend our care and our concern to all of our friends, neighbors, and families in Pitkin County. On a somber note, I am very saddened to inform that we've learned today that Pitkin County has suffered our first death in our community as a result of the COVID-19 virus. We extend our deepest sympathies to the family and friends in this loss. This news reinforces how we have to take the risks to our community seriously so we can minimize these times of loss and grief. As this demonstrates, we are going through an unprecedented experience, and I know that the individual feelings can range from uncertainty to real despair. People don't know when their next paycheck may come in, people don't know where their next meal may come from, and people are scared for their own health and the health of those that they love the most. I'm here to tell you that we have your back. The county, along with our many partners, including the City of Aspen, Snowmass Village, Aspen Valley Hospital, all of our first responders, we are here and we are working to take care of you. We will do everything possible we can to keep you healthy, keep you in your home, and to get you and our community back on its feet. We are doing this through our strong public health orders, our emergency assistance fund, and our many partnerships, many of whom you will also hear from today. Our community has gone through hardships before, though nothing like what we are enduring now. Unlike other events we have faced as a community, this pandemic is not easy to see or to know the full extent of. It is more difficult as a community to know how to come together and what needs to be done. That is why we all need to follow the guidance of our public health experts from CDC, Colorado Department of Public Health and Environment, and most of all, our local public health orders. This is a time for us to come together as a community to slow the spread of the virus by staying apart, staying at home, practicing good hygiene, and acting with compassion, generosity, and patience towards one another in these difficult times. I can assure you that Pitkin County, along with all of our municipal partners, are working our butts off every single day to protect and support your families. So even while we don't have everything we need that we would want to respond in the absolute strongest ways possible, we have an incredible incident management team and a superstar public health team who, in partnership with Eagle County and Summit County, reacted faster than anyone else in the state to issue the state's first public health order, which was among the strongest in the whole country. It is this quick action, combined with the community's cooperation on these public health orders, that will ultimately keep us and the people we care about most safe. Ultimately, it is up to us to do all we can to care for one another. Your Board of County Commissioners are working every day to ask our state and federal leaders for help. We've asked for our partners in the Forest Service and the BLM to send people to help us with logistics, planning, and communications. We've asked for our governor to fill our requests for medical supplies and test kits. We're fighting to make sure that our many self-employed neighbors do not get overlooked in the federal relief bills. We're fighting to make sure that small businesses don't get ignored while big businesses get bailed out. We're fighting to make sure that money comes directly to local governments because we know best what our community needs and how to get back on our feet. We are fighting for you and we will take care of you. Our Immediate Economic Assistance Fund has $1.3 million from the county and our municipal partners. It is directly helping Pitkin County families to keep food on their table and to make sure their rents and mortgages are paid. I've been so moved to hear the stories of people reaching out, almost universally saying that they think there are probably others who need this help more than they do. We all need to help each other out right now. Pitkin County is going to help you fill your family's needs and take care of you. Even if you don't think you need aid now, or have maybe thought you would ever ask for aid like this, please apply at pitkincounty.com/gethelp. This community has stepped up like it always does to take care of each other. Our neighboring counties have sent staff to back us up in our Emergency Operations Center and answer our Aspen to Parachute hotline. Individuals and organizations have had an incredible outpouring of volunteering and donations to make sure food is on people's tables, meals and essentials are delivered so those who are sick or vulnerable can focus on getting and staying healthy. But in the response to this virus, I have to ask our community for even more help. While we have had an incredible outpouring to take care of each other, we need more in the way of specialized supplies and healthcare workers. We need more personal protective gear, such as gowns, gloves, masks, swabs. We need more trained workers in public health, epidemiology, and infectious disease. And if you can leverage any of your contacts or stockpiles, please contact the BOCC. Our email is bocc@pickenscounty.com. I've been hustling to piece together orders with commissioners from other counties, to contact old colleagues who make protective gear, to link retired public health officials with our IMT. And you are going to hear more of these similar requests. They're coming from the FDA, from our governor. I would really ask you to please consider helping Pickens County first. The virus is here in our community. More people are getting sick every day, and we have a large vulnerable population. Pickens County will take care of you, and I know that Pickens County will take care of each other. Please keep each other in mind in everything you do right now. Stay home, keep your family close, and everyone else far away. Wash your hands. You will hear from our incredible response team this afternoon, who will tell you about how this virus is spreading, how the hospital is preparing, how we are going to get the virus under control via testing, and how our municipal partners are partnering closely with us to make sure every need is answered. And I promise you that going forward, you will hear more from your county commissioners. We will be more upfront about what we need, what we're doing, and how we're prepared. The communications always lag after the action. But we know that you want to know everything we're doing, you deserve to know, and you'll hear more from us. Pickens County will take care of you. So with that, we are going to move into our agenda, where we're going to hear from the members of our IMT and our municipal partners. And I'm going to first ask that for a public health update from Karen Kunneman, the Pickens County Public Health Director.
Good afternoon, everyone. Kelly, I just want to do a quick check to make sure you can hear me okay.
Karen, we can hear you great, and see you and Gabe sitting 6 feet apart.
We are. Yes, thank you. Yes, so thank you for letting me chat with you all a little bit today about our public health response, what sort of the trajectory and timeline of what's been going on. And so just to do a quick recap, you know, three months ago, a new virus known as SARS-CoV-2 actually emerged in the human population. And at that point, researchers rapidly began to study the virus to understand its genetic fingerprint for a detection test, learn transmission modality, how it impacted different demographics, and to begin work on a prevention, which would be a vaccine, and also treatment, which would be an antiviral. The initial global containment response was to prevent the virus from becoming endemic, like influenza or chickenpox. And as the virus spread and turned into self-named, who named, the World Health Organization named COVID-19, started to spread on a global level. Yes.
I'm very sorry. I'm going to ask you to pause for a moment because we are not hearing well here.
Okay.
So look into IT.
I think it may be the air conditioning in your suite there.
So. Sorry, just give us a second. Sure. Let's try this again. And Kelly, can you let me know when I started to cut out so I don't repeat, or if you want me to start from the top?
I think it will be helpful for you to start from the top.
Okay. So 3 months ago, a new virus, SARS-CoV-2, emerged in the human population. And at that time, researchers rapidly began to study the virus to understand its genetic fingerprint for a detection test, learn its transmission modality, its impact to different demographics, and they began work on a prevention vaccine as well as an antiviral treatment. The initial global containment response was to prevent the virus from becoming endemic, like influenza or chickenpox. And as COVID-19, the illness, spread on a global level and became a pandemic, there was a realization that unlike the 2002 SARS-CoV-1 virus or the MERS-CoV-1, Middle East Respiratory Syndrome virus, had spread, this new coronavirus was going to become endemic in the far reaches of the world. New knowledge comes out weekly, utilized at the global, national, state, and local levels to devise a strategy to slow the spread of COVID-19. And really, when we think about the goals of these strategies for our community, that really includes the prevention of mortality by protecting our most vulnerable, vulnerable to the illness, to preserve our healthcare and first responder infrastructure, and to ensure, as Kelly was mentioning, supports are in place for our community to deal with and recover from this event. Those will continue to be the goals of our response in the IMT as well as from a public health perspective. On a national or global level, they're still working toward developing a vaccine and antiviral treatment. As we start to do strategies that slow the spread of the illness in our community, it buys us time collectively to have vaccines and antivirals in place to be able to better deal with COVID-19. Every day we learn new information about this virus, how it's being transmitted, what populations might be most impacted, and how it gets transmitted. And I would say it's an evolving world right now in science, and we learn, again, new things every day. And as a community, we're really trying to pivot and be reactive and responsive to the new information that we learn, and we have continued to be fairly aggressive and proactive in our strategies. I think that people can see that the state has been following behind Pitkin County in their responses, and we have just been a little bit ahead of the curve, leaning forward in our responses to the spread of this virus. And that's hard. As Kelly said, all of these strategies that we have put in place, we recognize the implications to people's lives. And I just want people to know that we do not take these decisions and these strategies lightly. We recognize the impact that this has on the community. But I just want to really reiterate that we are looking at preserving the healthcare system for those who need it the most. We're looking at physical distancing, but not social isolation, and how we can come together as a community to support each other. And so the strategies that you've seen employed in Pitkin County have really followed in line with, first, a containment strategy of looking at how do we better understand what's happening in our community, looking at testing from an epidemiological standpoint to understand a bit about how the virus was spreading in the community. So once we had our first case on March 8th, we did some drive-through testing to better understand if there was community spread. So that was a containment response, and really looking at how do we keep this virus and disease from spreading in our community. Once we recognized that there was community spread, we really went into a mitigation response, and that's when the first public health order was put in place. As Kelly said, it was done in partnership with Garfield and Eagle, and it was the strictest public health order probably in the country, one of the strictest orders in the country at the time. And what we recognized was that there was community spread and that we had to mitigate for that. The last public health order, the stay-at-home order, is really a suppression, active suppression strategy where we're looking at really tamping down, and some of you may have heard the term flattening the curve. And what we're really trying to do is, when we think about from from an epidemiological standpoint, we have a certain number of cases and we have a timeline in which those cases emerge. And we really don't want to overwhelm our healthcare system with a huge spike in that curve. So flattening the curve allows us to keep our healthcare system intact and really flatten that out. And a suppression strategy that we're doing with a stay-at-home order is an order that really flattens that curve as best as we can. It's the best strategy we have. We recognize that there is an epidemiological need for testing in the community to understand the transmission of the virus, but until we have the PPE, which is the personal protective equipment for our first responders and healthcare workers, that is precious commodity. And right now, even with the latest strategic national stockpile shipment that the state of Colorado got, they've gotten 2 shipments so far, and that's getting distributed through our the whole state. And those 2 shipments are enough for 2 operational days, 2 days of operational cycle, so that we would be able to respond in our community. So I just want to say, when we talk about a supply shortage, that's what we're referring to, and that PPE is precious, and we need to ensure that our healthcare workers have it when they need it. And so when we think about testing, as we get to places like, or we get to evolve to testing strategies that might not need as much intensive PPE or might not need as much turnaround time, tests are taking sometimes up to 9 days to turn around right now for results. So we really want to hang our hats on rapid testing that can be turned around quickly, that we can do quickly, and that will give us a better sense of disease transmission. But until then, in the hospital, we'll talk about more of a clinical side around testing, but from a public health side, epidemiological side, that's what we're looking at. But until then, we have our symptom tracker, and if you go to pitkincounty.com and click on the coronavirus link, you'll see a link to a symptoms tracker, and what we're really trying to do is do a subjective way of tracking COVID-like symptoms in our community that also gives us an indicator of what's happening in our community. So we strongly encourage, if you're symptomatic, to take that survey. We also have an emotional tracker survey just to see how everyone's doing around the social or the physical distancing, not social isolation, and just to see, get a pulse on the mental health of our community. We recognize that this is really, really difficult and it's a struggle to not be connected in a way in our community that we have never been before. And so we encourage people to take the emotional tracker. Anyone can take that, but certainly if you're not symptomatic but would like to share some information, all the information you share is non-identifiable, so it's will be collected in aggregate. And so we just encourage our community to take those surveys and to use the symptom tracker as a way that we can better understand COVID-like symptom spread in our community in absence of broad-scale testing right now. And Kelly, that's all I have.
Okay, Karen, thank you. I don't plan to surprise presenters with questions, but I do want to ask Karen, can you please just give us a snapshot of the spread of disease right now in terms of our number of positive, negative tests and hospitalizations?
Yeah, I might. Do you have this?
I don't have them right
sorry.
in front of me.
Yeah, sorry, Kelly. Let me just. I'll come back to you on that.
Okay, we'll check in. I'll check in after Gabe before we go to the hospital.
Sure.
Thank you. Gabe, are you ready to give us an update on testing?
I am. Thank you, Kelly. I appreciate it. So I just want to echo a little bit of what Karen just mentioned about testing and our strategy around that. As we've mentioned before in our community meetings, part of what we're trying to do with testing was to help guide us in strategy. And so the first thing that we did, the moment we realized we had cases in our community, we did start doing larger scale testing, not only just at the hospital, but we also did some drive-through testing with those in vulnerable populations within our community. The goal of testing initially is to figure out if we can contain the virus where it is. And as many people have heard, we had an initial cluster of a virus in our community. We found out about that. We initially tested that group. And the goal being to see if we can contain it in just that group and not let it slip out into our community. With the drive-through testing, we then did a little bit more one ring out, if you will, with testing to try and figure out if it has escaped that initial cluster and now moved into community and community spread. So we did a small amount of community testing. At that point, we felt like we had enough knowledge to prove the point that we had community spread. It has now escaped that initial containment group and gone into the community itself. So with that, we immediately pivoted to a mitigation strategy, and mitigation definitely has action to it. So our goal with mitigation is to put public health orders in place. It makes sure that our community, we start messaging differently. We put action into our strategy with that. Now that we've been in mitigation and we have, again, a very strict public health order, again, one of the strictest in the country, now that we've got that in place, now that we have mitigated the virus as much as possible, now we move into suppression strategy, which is how do we take the virus, what amount we do have in the community, and continue to tamp it down so that it has less effect for us in the community. Now, does this mean that we won't ever test again? And the answer is no. One of the strategies, and as we continue with suppression, we obviously want to be able to measure that and understand if we are having success with that. So now that we are continuing to suppress the virus, we are looking towards a different type of testing strategy, which is rapid testing. And what rapid testing will allow us to do is potentially do two things. Number one, it will allow us to look at quarantine and isolation and our mitigation strategies and see how far those have gone, how well those have worked, if they were successful. But then it also gives us such a rapid turnaround that we may also be able to use that for some treatment strategies. But to go into that a little bit further, our next speaker, Dr. Holmes, will be able to comment a little bit more on that. And if I could, I'll transition to Dr. Holmes, let him talk about the rapid test itself. But keep in mind, we have those tests on order. We hope to find out soon when those will actually be distributed. As you've seen in the news from all over the country, there are many, many communities that are waiting for that rapid test. We are on the list. We are one of the high priority areas just due to our the mountain communities seeming to have a little bit more of a pocket of the virus than others. So we are on that list. We hope to find out soon when that rapid test would be available to us. One of the questions with the rapid test, of course, is, well, how is this different with PPE, personal protective equipment? How is it different with personnel? And the nice thing is that the rapid test is done with a finger stick, a small needle stick in the tip of the finger that allows us to get a drop of blood. The good news is that it doesn't produce any aerosolized virus, so that we will be able to use less PPE, we'll be able to use less personnel, and it will be a very streamlined and efficient approach to testing. So with that, I'll turn it over to Dr. Holmes to discuss the testing itself and the specifics of that.
So let me jump in here. For those watching at home, you had just heard from Gabe Muthing, who is the Aspen Ambulance District Director. And now we're going to invite Dr. Bradley Holmes from Aspen Valley Hospital to give more information on the testing.
Well, thank you, Gabe and Kelly. So just to talk a little bit more, especially about the rapid test, as you mentioned, I think we should talk about the testing that we are able to do right now, just so people have an understanding of the difference. And what we have been able to do so far are what we call nasal swabs, where they take a swab and they have to stick it quite far up your nose, and it usually causes people to cough and sneeze, and which can spread the disease, which is one of the big reasons we need to use all that personal protective equipment when doing this test. And when we first started testing, the only place that we could do that was actually at the state lab, and the turnaround time for that was initially supposed to be just a couple or a few days, but we quickly found out, and with people sending tests from all over the state, it ended up being a week. We still have some test results that are not back from 2 weeks ago. Private labs have become available in the last week, but they are also completely backlogged from around the country and are also taking several days for that. This test itself actually tests for the actual virus or RNA in the virus, and so it detects when it's available. But one thing to point out is this testing that we have been doing is not 100% accurate. In fact, quite a large number of people, roughly about 25% of people who have the virus in them will actually test negative. So it's one of the important reasons that the county and us as the hospital have not pushed to use it as much as a lot of people would like, because it doesn't accurately tell us if somebody is negative or not. So if somebody were to test negative, our recommendation is still, we can't say you don't have the virus, you should self-isolate, and if you get worse, then you should come to the hospital. These newer tests that Gabe was referring to is a blood test, and so we don't need to do any swabbing. It's just one drop of blood onto a small little piece of, I believe it's plastic equipment, and we can have the test result, I think, within 15 to 30 minutes, maybe even faster. And what it does, it doesn't test for the virus itself, it actually tests for antibodies. So this is something that your body will produce when it encounters an illness, and it's how vaccines work. Or if you were to become sick, your body starts to develop it's a protein called antibodies, and they circulate in the blood. And so this test will be able to detect those. And it's also not going to be a perfect test, and there will be some what we call false negatives, or people who have the disease and still will test negative, but it's still better than the current testing with the nasal swabbing. And the additional benefit is that it is much quicker. However, it does take your body about anywhere from 3 to 5 days to start producing these antibodies, so the test probably will not be effective in the first few days of an illness. So that is also something that we will need to take into consideration when we're using it at the hospital, in the clinics, and at the community level. So it also is not a perfect test, but again, if we were able to get larger quantities and get a large number of tests out there, it will be very beneficial. So I think that's it for me, Kelly.
Okay, thank you. And let me just check in with Gabe Muthing of the Ambulance District again. Gabe, did you have anything else you wanted to share?
No, thank you, Kelly. I think Dr. Holmes covered it.
Okay, great. And I'm going to go back and ask Karen if you could please give us the snapshot of how the disease is spreading in Pickens County.
Yeah, so Kelly, our confirmed positives are 21. We had confirmed negatives as of last night at 28, and results of tests pending still at 4. I want to acknowledge, though, that now that private healthcare providers are sending results to private labs, that we don't get the negative case numbers anymore. They could go straight to the healthcare provider, so the healthcare provider can alert the patient. But as far as from a public health standpoint, we only get we will now only get confirmed positives unless they're run through the state lab. So we'll start to get a little bit of disparate information around that we'll only know the confirmed positives in our community. We won't be able to accurately track the confirmed negatives, nor will we always know the results pending, because if a private healthcare provider sends that into a private lab, we don't get notified of it again unless it's a positive case. So the numbers are going to start to get a little bit less clear as we move forward. We'll always know the positive cases in the community.
Okay. Thank you for explaining that. Let me go ahead to Aspen Valley Hospital. Is Dave Ressler, the CEO of Aspen Valley Hospital, on the line? Dave, are you here with us today? Dave Ressler?
Can you hear me now?
Yes, okay,
Yeah,
wonderful.
can you hear me now?
Yes, thank you.
Can you hear me now? Okay. Sorry about that. Still getting used to this virtual technology for meeting, but it certainly is very beneficial. Thank you for the opportunity to comment on Aspen Valley Hospital. I thought it'd be helpful to first talk about what our current status is, what kind of patient volumes.
Unmute.
I'm done. I'm good. Patient volumes we're experiencing. We have had so far 10 admissions. We presently today have 2 patients in the hospital, one of which is critical. And I think it's important to note that we're starting to see more critical, sicker patients now, probably related to the life cycle of the virus. And Dr. Bernard is going to be following me, and she can speak to that a little bit more clinically. But it's important to note that the volumes are still relatively light. But again, we're seeing sicker patients. And in fact, we have already transferred one patient a couple days ago to a higher level of care at a lower altitude, which, by the way, is what our plan is with respect to patients that we expect to require mechanical ventilation. They do better at a lower altitude and in a facility with a higher level of care. The tests that we've done, to Gabe's point, we do continue to test all of the patients that we admit. So of those 10 admissions we've had so far, we have received 2 positive results back, 4 negative tests, and 4, to Karen's point, are still outstanding. We do not have the results back for those. In terms of the other activity that we're seeing at the hospital, each day we're having a few patients in the emergency department, but it's important to note sometimes they're in the emergency department for another reason. They may come in for a different purpose or a different, what we call chief complaint, and then in the process we identify that they have symptoms and need to protect ourselves for that purpose and also consider the treatment of the patient. Then I think the community knows as well that we established a what we call a respiratory evaluation tent that is out in a parking lot. Some of you have seen it. It's a technical tent. The purpose of that, as we've described in other communications, is it really is a place where if patients are presenting to the hospital for care because they believe they need emergency level care for severe symptoms, it's the first place we'll evaluate the patients. We have physicians out there and staff. They can test for other kinds of things like flu and strep, and oftentimes refer the patient back home to continue to recover at home. But when a patient does require emergency care, they will refer them on to the emergency department, but with the very important advantage of being able to advise the emergency department that a potentially infected patient is on their way in so that we don't compromise the staff or other patients. So that tent really is there to be able to provide an evaluation site and as a buffer to the emergency department. It also is available to physicians in the community, primary care physicians, that also don't want to compromise their practice and their staff and other patients. They can call us, make an appointment, and refer patients to the tent for evaluation. So that tent at present is seeing a relatively light load as well, of about 4 to 5 patients a day. So we are in the calm before the storm. And that is what I think is so critically important for everybody to understand, that we are pleased that we have a very manageable, if not light, level of activity with respect to the virus. As I said, they're getting more severe at times when they're presenting. And as you pointed out, Kelly, we had a death in the community already, but it's still not surge. It still is manageable, which is the goal. So I have to go back to Gabe's point about pivoting. When the IMT pivoted to a strategy of mitigation, as far as we can tell observationally, it's working. The whole point is to keep the level of patient demand for our services, particularly those critically ill patients, at or below our level of capacity, our level of our ability to treat them and manage that number of patients. So we want to keep the demand at or below our capacity, and it is working. And so I would also add that we have further evidence that mitigation works, and that's in Vail. I just spoke with their hospital CEO this morning, and he reported that they are back off of what just a week ago had been surge levels of demand. I think we've all heard about the activity in Eagle County, and they're back down now to more manageable levels. And he, too, attributes that success to the mitigation that's been occurring in Eagle County and the success that they've had. So my message is it's working. We know that many community members, as Kelly talked about, are experiencing such difficulties and pain associated with these mitigation efforts, economically, financially, socially. Totally understand that, but we're saving lives. We believe if we can maintain these efforts through what otherwise would have been the peak in that curve and keep that below our levels of capacity, then we're going to save lives. And that's what we're very encouraged about. But let's talk about those. Let me talk about those capacity levels a little bit, because we are still not resting on our laurels or backing off. We have developed comprehensive surge plans in cooperation with our physicians and our staff that we're feeling very confident in, again, as long as we remain within manageable levels of demand on our services. These surge plans take the resources that the hospital has. We take a creative approach to how we can most effectively apply those resources to meeting the needs of our most highly acute patients. That's the purpose of a surge plan. And it's very detailed, it has many protocols, and it covers the entire spectrum of our resources. And I'll just comment on a few of those. First of all, we all think about our beds. We're a small critical access 25-bed hospital. But the beds we're most concerned about in this type of a surge related to respiratory illnesses for this virus are our critical care beds. Those are the beds that we want to make sure that we're able to resource as effectively as we can. And as I mentioned earlier, at least while we can, we are going to refer patients that require mechanical ventilation to a lower altitude and a higher level of facility in Denver or Grand Junction. But that assumes that those facilities will continue to have capacity. We are looking at a statewide resource potentially situation or deficit situation. And so as long as we can, we will refer those patients down. But we also work with a system of all the hospitals in the state that's electronic called EM Resource that allows us to get an immediate view, real time, into who has bed capacity around the state so that we can expedite the transfer of patients to where they need to be. So that's the bed situation. The other two critical areas that we are planning for carefully are staff and our personal protective equipment. Staff, the most important thing we can do is keep our staff and our physicians healthy. That is why we have taken such dramatic efforts to reduce the traffic in the hospital that we don't need to be here and to be able to protect our staff from the virus. And so far, we have had staff members that have been out ill with various kinds of symptoms. We have tested a couple of them with more severe symptoms, but we seem to be holding our own. We have a full complement of staff, or a near full complement of staff and physicians right now, and we need to keep it that way. So we're doing everything we can to protect the health and maintain of our staff and maintain a ready mode. The second item is personal protective equipment. Oh, and one more comment about staff real quick. Thank you to community physicians that have been retired or are no longer working that have contacted us and say, you let me know when you need me to come in and help. These are licensed physicians that have a lot of experience and they have offered their time. We don't need them yet, but we have a resource list and we will contact our physicians and other types of licensed and other professionals in the community, to Kelly, to your earlier point, if we need them. Okay, coming back to personal protective equipment. As was mentioned earlier, we do have access to the National Strategic Stockpile in this community, which is awesome. But I have to compliment our staff and our purchasing staff for planning ahead, and we did create adequate inventory for a reasonable escalation in our demand on our services or influx in terms of personal protective equipment, but we are being extremely judicial in its use and thoughtful about how we are using that PPE, because again, we don't know what's coming. So that really is a pinch point. There are hospitals all across the state that are, and the nation, as you know, you're watching it on the national news, that are crying out for additional PPE. They're making up masks and creating other kinds of solutions in the absence of actual appropriate supplies. So we have to be extraordinarily careful in maintaining what we have and being prepared. So the last comment I want to make is people often ask, well, what about the number of ventilators? How many do we have? And the answer is we have 5 ventilators, which is a significant number for a hospital of our size, but we want to keep a couple of them available for transports of critically ill ventilated patients, as I mentioned earlier. But going back to the creativity of a surge plan, we also use ventilators for general anesthesia when we have patients in the surgery, in the surgical suites. We're able to reapply those, and that's another to critically ill patients in the hospital. And that's another reason why it's been so important that we curtail all of our other elective activities and maintain all of our resources for our surge capacity. So I could say a lot more about our surge planning. It is a living document that we're constantly updating and adding ideas to. But the last point I would make is, and I think this too is critically important, we are cooperating and collaborating with our hospitals in the region and across the state to make sure that we're able to share resources and lean on one another to create for the greater good, to create a more collective ability to respond to this crisis. So we are meeting with Valley View Hospital in Glenwood Springs, Grand River Hospital in Rifle, Vail Health in Vail, and also maintaining contact with all of our other peer hospitals across the state. So I think that's all I have for now, and I appreciate the opportunity to talk about what we're doing here at Aspen Valley Hospital. Thank you.
Great. Thank you, Dave. And I would also like to invite Dr. Catherine Bernard from Aspen Valley Hospital to give us a medical provider point of view.
Hi, thank you. Can you hear me?
Yes, we can. Thank you.
Great. I am Catherine Bernard. I am at the Aspen Valley Hospital. I am the current president of the medical staff and also a full-time practicing emergency physician at AVH. So first of all, I think you all know that on Monday, the entire medical staff voted unanimously in support of these public health orders. And doctors are rarely unanimous about anything, but we are very grateful that the county did this quickly. It has so far prevented a surge that overwhelms our system here. But as we see in the communities that did not do that as rapidly, they are becoming overwhelmed. So I just want to say, you know, this is no time to become complacent. That said, also, I know we already talked about testing, but testing needs to be safe, effective, and efficient, and really none of the ones available right now are that, which is why it has not been done. Accuracy is poor, and in my opinion, bringing people together right now with this community spread, people with symptoms, people who had recent symptoms, and asymptomatic people is not only a bad idea, it might be dangerous. So as a doctor, I promise to first do no harm, and I would not recommend that. So it's exactly what we're trying to avoid with public health orders. So I did want to say also that even though we're not overwhelmed, we are seeing very sick people here, and we do usually send those people to our referral centers. which are starting to see surges. So again, I just want to say thank you to all the officials who made these difficult decisions. I want to say thank you to the community for your support, because I know a lot of you feel like you cannot do anything or you're not allowed to do anything, but I will tell you, you are doing something that we cannot do, and we cannot do our jobs without your support. So thank you so much for allowing me to deliver that message today.
Lovely to have you, Dr. Bernard. Thank you. So in this portion of our program, we're going to start to move into hearing from our governmental jurisdictions and how this is affecting our operations and how we're planning and responding. So I know the community has heard a lot from Pickens County, so I'll give some brief remarks, and then we'll move into inviting our representatives from our municipalities to speak. So with regards to Pickens County, the Board of County Commissioners has appropriated $1 million for our emergency response fund, and this is divvied up into $500,000 for our economic assistance fund, $350,000 for our public health response fund in order to stand up testing that we're expecting in the near future and such other things, and $150,000 in our general emergency response. With regards to the economic assistance, there has been really great uptake in that program. Within, I think we're at a week or 10 days since we've rolled that out, there have been over 800 applications for assistance, of which 645 are from Pickens County residents who, or households that represent over 1,000 people in need. And again, I would just encourage people, you know, if you're relying on about a month of savings, if you think you never would have thought you'd apply for help like this, please don't hesitate to reach out and to make an application into that fund at pickenscounty.com/get-help. This will help you to pay rent, buy food for your family, make sure you don't miss a mortgage payment, etc. We do want to give a thanks to Aspen Sea Company, who has provided us with 40 people who are following up on those applications and making direct calls. Everyone who's applied is getting a direct call back. Where can you find help, or where can you find information? So we have our pickenscounty.com get help. We also have pickenscounty.com, our COVID-19 webpage, and you can call our Aspen to Parachute hotline at 429-6186. We have been helping to organize food distribution with Aspen Family Connections, so there will be more food drives in the future. The Aspen Community Foundation is coordinating volunteers, so Valerie at aspencommunityfoundation.org. And if you are still trying to do regular business with the county, we do have some closures, but we also have many online services, and we do have staff in our departments that are answering their phones and trying to help people guide through keeping business going as usual, and that can be found at pickenscounty.com as well. So in the interest of time, I'm going to move us along and invite Mayor Torrey with the City of Aspen to give us an update on the state of the city.
Yep, there you go.
Great.
Thank you, Kelly. Thank you. I'm checking just to see, can you hear me okay then?
Yes, we can.
Thank you very much. Thank you to all of those that have been working so hard on this effort. Thank you for those that put this together for this meeting. And definitely a thank you to those community members that are watching and getting some information here. I want to say hello to those Aspenites out there and truly the entire Roaring Fork Valley. We are one in this effort. We are definitely one, and we need to work together. As we all realize, we're still in a response phase. And during this response phase, what we are asking of you is to heed the public health warnings. That is job one for all of us. This takes a community for recovery here, and that's what we want in this first phase. During this first response phase, we are working on recovery. And those efforts are going on in the city, and I'll tell you a little bit about that in just a moment. First, I do want to say my warmest regards, thoughts, and prayers are with everyone in this time of crisis. But we are here for you. We're in this together, but we are here for you. Our valley and our community needs to come together in this effort. So first of all, I want to give you contact information, and that is that the city of Aspen is still doing business, and we're here for you to contact and communicate with. We're at 920-5000. That's our main number. That'll get you through to anybody that you need to speak with in the city. You can also reach us by email at cityofaspen.com. Go online, and you can find those resources there as well. As always, I want to give my personal information. If you have any specific questions or things that you want to share with me, I am at tori@cityofaspen.com, and my phone number is 948-2023. Feel free, please get in touch with us with any needs or concerns or suggestions that you have. To let you know what the city is doing, well, number one, our first priority was to support the county and essential employees that are giving such great concern to our entire community. So with that, we have made some motions in regards to child care and family services for these essential workers. We have lent a number of staff to support the IMT in the work that they're doing over there. So the city has given some efforts of personnel to this, and we continue to do so and look for ways that we can do that. We also, in this recent meeting that we had on Monday, or on Tuesday, actually, we joined in the county's efforts for financial aid to our community. We started with a $200,000 allocation for emergency assistance that will be distributed, as Kelly said, through the pitkincounty.com/get-help is a way that you can apply for these funds. And we want to make sure that everybody does, as Kelly was encouraging you. You never know if you're going to need it. You never knew you were going to need it, but please take advantage of it. We are so lucky to be here in this community and have such great resources. Make sure that you're taking advantage of those. Along with that, we have also had a number of community members offer their generous support, and we will be setting up a way for you to participate directly financially with us in making some of those aid and relief efforts available to Aspen working force. On other fronts, you know, for housing assistance, the city has in its control 200 units that are managed by APSHA. And to that end, what we've started to do is waiving any late fees for April rents. We are allowing tenants that may look to get out of their lease to be released from that without any penalty. We're also providing a month deferral for your rent for qualified renters that also will then look to utilize a 6-month repayment plan. Again, these are just starting efforts. We're looking at strengthening those as this crisis continues, but those are first efforts. We also want to encourage other landlords out there outside of the units that the city itself controls. We want other landlords out there to think about how they can be flexible and how they can work with their tenants as well. On business support, well, recently we've put out a business packet for aid. So you can access that on the city website. And there's some great information there. A lot of people are pushing out that aid information, and we will continue to do so as it gets updated. Still learning what's coming from the Fed and the state on that, but we do have a lot of resources for you. I and the rest of the city council here in the city of Aspen are actually reaching out to different business sectors, and we've divided that work up amongst the 5 of us to get information from you about what you need. We really want to be targeted in our efforts, so the more input that we can get from you, the greater our ability to participate with you is going to be. We are trying to keep our communications and our efforts coordinated and timely in order to make all of this work out. This is moving extremely fast. And what we need from you in the business community is to be working with us. So, you know, if you're an individual out there, we want you to get started on filing for unemployment. We suggest that you talk to your creditors, those that you have bills with, to be in touch with them about some of the efforts that they're going to make to be working with you as well. And also be in touch with your employer to make sure that they know what your actions are and that they have the availability of getting you back to work as soon as they can, as well as applying for the benefits that you can avail yourself to. We are going to be having some upcoming discussions, including some virtual town halls for business assistance, and we'll be linking those businesses to those resources. We've already started meeting with and reaching out to our local financial institutions to make sure of their participation in some of the federal grant and loan processes that are going to be coming out. We are also implementing as much local staff time and monies to get help to every businesses and what they're going to need to survive through this first period for sure. And we need to act on that as soon as we can. Again, I want to encourage those individual landlords that are out there to be working with their tenants as much as possible in this difficult time. There are definitely going to be different resources available to different segments of our economy, and we need to make sure that those are getting handled by everybody. We are in this together. As I said, we've been supporting the county and the IMT in their efforts, and we also want to thank them very much for the public health orders that have been issued throughout the last 2 weeks. We want to make sure that our community knows that if we accept the changes now and make some changes here in the short term, it is going to get better sooner. We want to fully endorse the public health orders, and we encourage Aspenites to take these very seriously and take measures beyond maybe even what are being suggested. And that just means that you are taking extra precautions of personal hygiene if you are to go out of the house, and making sure that your trips out of the house at this time are for necessities only. We want you to practice your social distancing. That's indoors and outdoors. Currently, local trails are still available for your use, but if we don't see that being followed in the protocols that are out there, I'm sure we were going to see more closures of those. So please do what you can. Other city steps that we're taking is falling in line with these public health orders. So for example, the city has stopped construction on its new offices construction site. We've also put a temporary halt on our affordable housing construction as we adhere to those public health orders. We at the city are minimizing in-person contact and using virtual meetings. So we're doing our best to make sure that we are following these public health orders. On the long-range recovery side of it, we are updating our revenue and expenditure forecasts on a daily basis. We're working on this nonstop to get a better estimate for forecasts on city operations and projections. You know, this has been a very difficult time for all of us, and as we all know, it's not getting better yet. We are going to turn the corner here. I just want to know that, you know, these are very difficult times, but this will end. We will get through this, and as I've said before, I think we have an opportunity to come through stronger on the other side than we go into this. People, be sure there are good resources that are available in this community to get through this both mentally and economically. Make sure that you are tapping into those resources, and we'll do our best to make sure that those are front and center for you to do that. We are so lucky to be here and have such a supportive community. Thank you to all those that have volunteered both their donations of food, money, and time, and doing what they can do. One last reminder, you know, by staying apart right now, we are standing together. We need to stay strong, Aspen, and our entire Roaring Fork Valley. We are in this together. Again, I am available for any of your questions and concerns. Please feel free to reach out to me at the city. That's all I have for now. Look for changing updates every day, folks. Stay safe and stay sane. Thank you, Kelly.
Thank you, Mayor Tory, and thanks to the city for your incredible partnership. I'm going to invite Town of Snowmass Village Mayor Markey Butler to please give us an update from Snowmass Village.
Thank you very, very much, Kelly. Can you hear me?
Yes, we can hear you just fine. Thank you.
And I want to thank everyone who has spoken already and our next speakers from Basalt for taking time today to give us a community update. I also chair the Pickens County Public Health Board. Shout out to Karen. Many long hours to her and the staff within the Public Health Department. So thank you, Karen. What I would like to say to everyone within our community, we know that we're very resilient, we're very compassionate, we're a very hardworking community. What we love about our little village is we're very, very small. And in a small town, you always know who's who. It's like the Cheers bar. You always know who needs help and what's happening within your local community. We want to thank people such as Gwen's High Alpine Restaurant, who spent one full day bringing all the food down and distributing it to individuals within our community over in our employee housing complex. We want to thank the Snowmass Chapel, who has created a network of phone banks and all the wonderful calls that they're doing to our community, so we know who needs help and what they need. A lot of food drives. A lot of us are picking up groceries, we're picking up mail. We want to thank everyone for doing that. Most importantly, I really want to thank Dave and all of the first responders and all the staff at Aspen Valley Hospital. What a yeoman's task to organize an emergency plan in a very short period of time, so thank you. I also want to give a shout out to our mental health workers and all of our other healthcare institutions. And if you will, my background being hospice and home care, those workers who are taking care of the sick and the dying in their homes. Now let's begin to turn our attention for how hard we're working with our partners. There's nothing more important than working together during a period of time like this. To my colleague Tori over in Aspen, Ryan Mahoney down in Basalt, all of my colleagues with the Board of County Commissioners, the IMT, it is wonderful to work together and also to learn from one another. No one has all the answers, but the only way that we can continue to work together is to listen and to help. We strongly support the county and we support our medical community in their efforts to increase the testing available. That, as we all know, has been the #1 complaint from most of my constituents here in Snowmass Village and throughout the county. I know that we've prioritized the limited amount of tests that are currently available, and I applaud the decisions to limit them since there are not that many. The health department's efforts to strengthen the public health order was not easy, and those were tough decisions that the public health department had to make. And we beat most of the county, not the county, but the country, and we beat the state of Colorado, and needless to say, the results speak for themselves. As a town, we encourage all of our residents to take this very, very seriously and not leave their homes for anything except essential activities. This includes when you go out to recreate, which I do every day, a long walk, long hikes up here on the mountain, because there's no one here in Snowmass Village right now. We'll keep that a best kept secret. But when you go out to exercise, make sure you keep your social distancing. And also, if you're walking with your dogs and your dog sees another dog, remember that even though the dogs don't carry the virus, they do come in contact and they might have some of your germs on the dog's hair. So that's really, really hard for me because I have 2 large dogs, and they love everybody. They love to go up and greet every dog, and the owner of that dog and I talk about social distancing, and it's really kind of interesting at best when dogs don't understand that. The other thing that's very important, we're working with every individual in our community and all of our businesses. And if you need anything, please feel free to reach out to myself, 379-4427, my website, mbutler@tosv.com, to Clint Kinney, who is our town manager, who is working many long hours with all of our infrastructure here in Snowmass. One thing that's very important, we are committed to not losing anyone within our workforce. So to that end, we are working with our workforce housing, Betsy Crum, who is our housing director, and making sure that she can work with everyone in our 247 rental units to be flexible on payment options, no evictions, no late fees, and any assistance that they need. We're also committed, at least our town council made the decision that what we needed to do was really extend a financial support to those in need through $100,000 being our first tranche of money going to the local COVID-19 relief fund created by Pitkin County Human Services. And that means we may need to do more. Who knows? But we're here and we'll help whatever way we can. So needless to say, we would like you to also support our local restaurants. We want our businesses to be strong and healthy. Slow Groovin' Barbecue is open. If you've never been there, it's awesome. So order a takeout. Taste the Philly on the mall, and of course, Tasters, which we've had for years and years here in Snowmass Village. Our town has decided that we're going to extend our filing deadline for the sales tax rebate. So we have honored that, and we're putting all of those gears into motion right now. Last but not least, I want our town to know that we're very concerned about each and every person. We need to continue to be kind, compassionate, and healthy. And by doing so, we're going to get through this together. So again, feel free to reach out to me, to Clint, or other members of our town council, and whose names are on the website, tosv.com. Thank you, and enjoy being outside.
Thank you, Mayor Markey Butler. We really appreciate your message and your appropriations to our fund, and then your ongoing support of the efforts of our IMT. So thank you. And now I'm going to invite Ryan Mahoney from the town of Basalt to give us an update from Down Valley.
Okay, Kelly, thank you very much. I'm speaking today on behalf of the town council, and I think my skills here on Zoom meeting and this platform have certainly grown over the last few weeks, sort of my daily routine. For the town of Basalt in the Mid-Valley, this has really been a balance of, the reality of living in two counties. And as such, what that means for us is, attending twice as many calls and trying to disseminate information from two different entities, which has been working really well so far. And we've really relied on the public health staff from our partner counties and their expertise, as we do not have that public health staff on our end. And so that's been really great for us, and we certainly learned a lot and been able to keep the information flowing. And I do want to say, as we've been working through this, as we did through the fire, that flow of information has obviously been extremely important to our constituents. And, each day, I think we are course correcting and making sure that we're responding to the folks out there. So I really hope that you're able to see that and you're able to get the information that you're hungry for. As a quick plug, for those of you out there that are tuning in from Eagle County, ecemergency.org is the website that Eagle County has set up with all the details on the COVID virus, and then of course pitkincounty.com has been the resource for the folks in the Upper Valley.
Hey, Ryan.
I think I can say for
Ryan,
for
can
those
I interrupt
in the
you
entire
real quick?
Mid-Valley, that we've really appreciated the regional cooperation thus far. We've got Eagle County, Pitkin County, and Garfield County that have been working really hard to align their strategies. And up until this week, the health orders actually matched pretty darn closely. Pitkin County did put out a new public health order earlier in the week that made some changes from Eagle County. We've been able to manage through those well throughout the week. I've certainly received a few phone calls, and so far been pretty easily able to explain those differences. For those that are listening, the main difference really is that Eagle County did keep some non-essential businesses open, so long as they were practicing good social distancing techniques, as well as construction sites. Now we know that Governor Polis last night put out a new public health order that tightened things down for the entire state and brought the public health orders from the 2 counties into closer parity. And so we're obviously reviewing that today, getting some clarification, but we certainly support what's happening around the state, and we really want to see that epi curve flattened over time and keep everybody happy and healthy. So a few things on Basalt-specific items. We closed our town hall and our other public buildings about 2 weeks ago on March 13th. And that same day, the town council put in the emergency declaration. And so since that time, we are still here as a staff providing services to the community. Our police staff is out there. They're taking an active role in the incident management team, or IMT. They're out and about talking to the community, just making themselves present so that they can answer questions. We're certainly getting some feedback from folks that being cooped up in their house or not being able to go to work is creating some anxiety, and so being there as a resource has been extremely important for them. And then, of course, working with them, so many of our police staff have expertise in incident management, and really helping me and the rest of the team work through some of our strategies. So thanks so much for their assistance. Our public works staff also has been a great resource, making sure we're out checking on our amenities throughout town. We did have a snowstorm last week, and they were able to jump on that. And probably one of the most important things is our water resource, and making sure we're keeping that fresh and healthy water flowing into people's homes. And so rest assured that that will continue. And then our clerk, Pam Schilling, has been doing a wonderful job. We have an election coming up on April 7th, and the timing of that coinciding with this is somewhat unfortunate, but what is fortunate is that it's a mail-in ballot. And so folks have received their ballots at this point. We encourage everybody to vote, and to get that in, there is a drop box here outside of Town Hall that will be checked very regularly, and then of course you can mail those in as well. Finally, the council's been extremely supportive through all this, and really helping to guide the dissemination of information, hearing from their constituencies as far as what information is needed. And so, I want to make sure I thank them for that input, as it's been invaluable. Also, I think one of the important things for them is really to keep safety at the forefront. We know that a lot of our businesses and community members during this time are really struggling, and we know that we can get through this. We have to double down, as we've seen with these health orders, but we will get through it. And so the council is there to support in every way that they can. And so to talk a little bit about that briefly, this has obviously been quickly evolving. We know that the Fed and the state are coming out with resources. We've been on the phone regularly with our friends at the county, the other cities and towns throughout the valley and beyond, and that also includes our local chambers of commerce. And without this team approach to it, there is just such a large body of information coming to us with these resources. I think the SALT's role, as well as that of the chamber, is really going to be that local resource, the clearinghouse of information, so that we can make sure that those resources that are out there are clear, and we'll do what we can to make sure that we get people taken care of as quickly as possible. Let's see, finally, I do want to make mention as well, for those individuals that are struggling to come up with payments for rent. I know it was mentioned earlier, But if you're tuning in from Eagle County, make sure you go onto their website, ecemergency.org, and then Pitkin County's as well, which is pitkincounty.com/get help. Those have been wonderful resources for folks to get financial help, whether it's rent or food. And make sure you're also tapping into that mental health piece. Get out, take that walk, get out for a bike ride. That's been my solace through this time, and it certainly helps, even if it's a short one. And then, as we heard from Marky, our businesses, several of them are still open. So make it a point to patronize those businesses. They are our backbone, and we certainly encourage them through this hard time. And then finally, I want to make sure that everybody out there knows that we're here to support. You can email me, you can email any of our staff members, our council members. If you have questions, we're happy to be that clearinghouse of information for you as we can. And as we saw in the fire, we know that this community will rally together. This time it's a bit different. We're doing it from afar, but certainly I know that everybody in the community is doing their part. So thank you so much.
Okay, thank you, Ryan. We appreciate you helping our neighbors on both sides of Basalt navigate through this, and acknowledging that our partnerships with our municipalities will become even stronger in the recovery phase of this emergency. Thank you to everyone who participated today. Again, I do want to extend my deepest sympathies to the family and friends of the community member who we lost to COVID today, and also to all those who are sick with this illness or caring for those who are sick. We are thinking of you. We're keeping you in our hearts. I want to thank all those who are staffing all of our essential services, our healthcare workers, our transportation at the airport and on RAFTA, our grocery store workers, workers at the hardware stores, the pharmacies, our open space and trails team and rangers for keeping that amenity available to everybody. The press who are getting this news out on our behalf, Grassroots TV bringing this to you today, KJAX and KDNK who I believe are live with this as well, our road and bridge crew who are still plowing our roads when needed, our waste haulers for keeping us clean and safe, and our banks remaining open. And then of course, those who are home care providers, our first responders, our neighboring counties and municipalities who have been tremendous partners in responding to this emergency, our incident management team, and our emergency operations center who are incredible and working tireless hours. And my apologies to anyone who I may have forgotten on this list. You are in our minds and thoughts. Pitkin County will take care of you, and I know that Pitkin County will take care of each other in this emergency. Please keep each other in mind in everything you do right now. Practice extreme hygiene, stay home, keep your family close, keep everyone else far apart. We will come through this together. We will be together again soon, and I look forward to that time. Thank you to everyone. Thank you to Grassroots.